Here is a detailed and comprehensive explanation of Zidovudine. Basic drug information. Generic name Zidovudine. Drug class, antiretroviral agent, nucleoside reverse transcriptase inhibitor, NRTI. Dosage forms. Oral tablets, 100 milligrams, 300 milligrams. Oral capsules, 100 milligrams. Oral syrup, 10 milligrams per milliliter. Intravenous solution, IV, 10 milligrams milliliters. Brand names, Retrovir, monotherapy form. Combivir, Zidovudine plus lamivudine. Trizavir, Zidovudine plus lamivudine plus abacavir. EU markets. 2. Definition. Zidovudine is an antiretroviral medication used to treat and prevent HIV-1 infection. It was the first drug approved by the FDA for HIV and remains a critical component in combination antiretroviral therapy, CART. It reduces the viral load, improves immune function, and prevents mother-to-child transmission. NAF3. Mechanism of action. Zidovudine is a synthetic analog of thymidine, a natural nucleoside. Inside cells, it is phosphorylated to its active form, zidovudine triphosphate, ZDVTP. It competes with natural thymidine triphosphate for incorporation into the growing viral DNA chain during reverse transcription. Once incorporated, it lacks a 3'OH group, preventing further elongation, thus terminating viral DNA synthesis. The inhibition of the enzyme reverse transcriptase, which is essential for HIV replication, is the core action. 4 uses. Treatment of HIV-1 infection in adults and children as part of combination therapy. Prevention of maternal fetal HIV transmission during labor and postnatally. Post-exposure prophylaxis, PEP. In healthcare workers after potential exposure, may be used in perinatal and neonatal prophylaxis to reduce transmission from mother to child. 5. Indications: HIV-1 infection in combination with other antiretroviral agents, perinatal prophylaxis in HIV-positive pregnant women and newborns, occupational and non-occupational HIV post-exposure prophylaxis, not used as monotherapy due to resistance risks. 6. Contraindications: known hypersensitivity to zidovudine or formulation components, severe anemia, HB 7.5 gram Dlella, neutropenia, neutrophil count 750 cells per advanced liver disease including hepatic decompensation, lactic acidosis, or hepatic steatosis history due to mitochondrial toxicity. 7. Before taking this medicine, precautions. Inform your doctor if you have liver disease, including hepatitis B or C, renal impairment, bone marrow suppression, low red or white blood cell counts, history of muscle disorders or myopathy. Alcohol use increases liver toxicity risk. Use of other myelosuppressive or hepatotoxic drugs. Pregnancy. Zidovudine is often used during pregnancy to reduce the risk of vertical transmission. Category C, FDA, benefits may outweigh risks. Breastfeeding. HIV-positive mothers are generally advised not to breastfeed in developed countries. Hatchet 8. How to use. Take exactly as prescribed at evenly spaced intervals. Can be taken with or without food. Oral syrup is available for children or those unable to swallow pills. IV form is used in hospitals, particularly during labor or for those who cannot take oral medications. Important tips: do not skip doses. Continue therapy even if you feel well. Always use in combination with other antiretrovirals. 9. Dosing information. Adults, HIV treatment, oral, 300 milligrams twice daily. IV form, for those unable to take oral, 1 milligrams kIV every 4 hours. Pregnant women, to prevent HIV transmission, oral 300 grams twice daily from 14 weeks of gestation. During labor, IV 2 milligrams per kilograms over 1 hour, then 1 milligrams per kilogram per hour until delivery. Neonates, 2 milligram orally every 6 hours for 6 weeks. Start within 6 to 12 hours of birth. 10. Missed dose overdose. Missed dose. Take it as soon as you remember. If it's almost time for your next dose, skip the missed dose. Do not take double doses. Overdose symptoms: fatigue, confusion, nausea and vomiting, seizures. Lactic acidosis, hepatomegaly, bone marrow suppression, emergency action required. Call poison control or go to an emergency room. 11. When to stop or avoid taking. Stop or avoid zidovudine if you experience severe anemia or neutropenia, lactic acidosis symptoms, deep rapid breathing, muscle pain, severe weakness, liver dysfunction, jaundice, hepatomegaly, progressive myopathy, especially in long-term use, allergic reaction, rash, swelling, difficulty breathing. Half 12, side effects in detail. Common side effects: nausea, vomiting, headache, fatigue, diarrhea, anorexia. Serious side effects: bone marrow suppression, anemia, neutropenia, lactic acidosis. Symptoms: muscle pain, trouble breathing, weakness. Hepatomegaly with steatosis, fatty liver. Myopathy, muscle weakness or damage. Liver enzyme elevation, skin rash, pancreatitis, rare. Seizures. In newborns, anemia, neutropenia, elevated liver function tests. 13. Vital information. Zidovudine is not a cure for HIV, but helps suppress the virus. Must be used in combination with other antiretrovirals to avoid resistance. Monitor. Complete blood count, CBC for anemia or neutropenia. Liver function tests, LFTs. Lactic acid levels if symptoms of metabolic acidosis occur. Do not share medications. Maintain regular follow-up. 14. Other drugs will affect zidovudine. Drug interactions. Increased toxicity risk with ganciclovir, ribavirin, interferon, bone marrow suppression, probenecid, zidovudine elimination, levels, methadone, zidovudine plasma concentrations, fluconazole, zidovudine AUC, atovaquone, zidovudine levels, valproic acid can alter zidovudine metabolism. Decreased efficacy with phenytoin may alter zidovudine plasma levels. Rifampin induces metabolism. Effectiveness. Stavudine, antagonistic to zidovudine, avoid combination. Would you like this? Thank you. Have a nice day.